So good afternoon, guys. Thank you for joining in today's session. So this is a progression of the series of series that we've been having for this champion cohort. So in our today's session, we'll be talking about effective communication, and Erin will be presenting to us. So welcome, Erin.
So I'll just share my screen. Today, we're actually going to be talking about effective communication and patient-centered care. So last week we talked about pain management, and the week before we were talking about symptom management. So a lot of clinical and evidence-based work that we've been doing as we shift into some of the psychosocial support that we can give patients. I'm hoping that you'll feel encouraged and feel motivated to find ways to integrate this into your care that each time when you come to the clinic and when you work with patients. So again, this is our kidney supportive care program. Just continue to want to encourage you in all the work that you are doing with your patients. And as you've signed up for this course, yeah, we're just really proud of you as you try to find holistic ways to treat patients who are dealing with kidney failure. So again, just know that we are here to support you. We're here to kind of be that sounding board on difficult cases, and yeah, we also want what's best for our patients as well. So by the end of the session today, we're hoping that you will be able to employ some communication techniques in terms of discussing prognosis with our patients, treatment options, and also care goals. We hope that you'll be able to find good ways to engage patients and families in shared decision-making. And that concept, shared decision-making, we will continue to talk about in a subsequent session. And then also find ways to be culturally sensitive and empathetic towards our patients. And the competency that we are aiming for is to demonstrate effective communication skills and patient-centered care in kidney supportive care. So we start with this quote. It's from Maya and Angelo, who said, "There's no greater agony than bearing an untold story inside of you." And I think as we take care of our patients, there are many times that we can go about our work and we cannot be present in our work when we are taking care of patients in the dialysis units. And I think as we come together today and over the rest of the course, we're hoping that communication can allow you to listen and to bear anot's story. And I think that some of these skills we may have learned in our training courses, we may have learned in our higher diploma training, and then when we get to the field and we get used to the work and it becomes very routine, we may not always be as passionate about communicating holistically with patients as we were maybe at the very beginning or when things were kind of new. And I think through the training program of supportive care, we hope that you will gain more skills, knowing that these discussions are not easy, but knowing that you are there to witness all that the patients are experiencing, the difficult days as well as the good days. And I think that's what we want to be here to equip you with. So today we're going to be talking about this, effective communication. So what does that look like? What does that look like in healthcare? What does that look like for our patients with serious illnesses? We know that effective communication is a core clinical skill, and it actually is the foundation for excellent and also successful patient care. So we can't really do our jobs well unless we effectively communicate. And we also can't really understand or know what's going on with people or our patients or what's going on in their lives unless we communicate well. So today, hopefully you'll become a little bit more confident in terms of how to communicate with your patients and what to do, especially as we talk about their disease and their prognosis, also their quality of life. So what is it? What does effective communication look like? So it is the process of exchanging ideas, thoughts, opinions, knowledge, and data so that a message is received and understood with clarity. So I think this, I've obviously highlighted that the message is received and understood. There can be many times we speak with patients or we speak at patients and we give them a message, but they may not understand it. And this is the important part of effective communication. When we do this effectively, the sender, so the person who has potentially some information, it could be blood work, it could be a change in their care plan. We as the sender or the giver of information, such as the healthcare provider, and the receiver, so the patient, the family, maybe they're curious to know how their blood work is doing during their monthly blood work, or they're curious to know if there's going to be any changes with their nutrition recommendations. We need to make sure that both the healthcare providers and the patients and families are feeling satisfied with the exchange, with the communication. We do this to share information. We also communicate to deepen understanding of patients. So we may actually, as healthcare providers, have to communicate the same thing repeatedly because a patient may not have fully understood the situation. And then we also communicate to gain acceptance and trust. This is a big thing, especially when we talk about supportive care. We need our patients to trust us, that the information we're giving is accurate, that it's sensitive. And we know that when patients have a positive relationship or a therapeutic relationship that's built on trust, we know that patients have a better quality of life. When we think of patient and family-centered care, you can see in the very middle of this diagram here, this is from an example of a patient-centered care from Canada. They have the patient and their family in the middle. So just really highlighting that the patient is at the center and the family is at the center. So in this example, maybe it's the mother that is the patient. You can see there, their spouse is there, the child is there. We have the entire family at the center. And when we think specifically about patient and family-centered care, it must be a partnership. So there's no sense in us coming up with a care plan for a patient and they not necessarily agreeing or it not being in line with their values, because they're not going to necessarily follow what we suggest if we're not partnering with them. Patient-centered care also includes information sharing. So maybe the patient has a question, we potentially have the answer, then we share the answer with them, and it's an engagement. Patient-centered care needs to be care that's coordinated. So we know for our kidney failure patients, they oftentimes have other comorbidities. So having the patient at the center of care and helping coordinate care ensures that patients don't miss some of their other important appointments. Maybe they have an illness that needs constant follow-up and constant treatment. We need to make sure that we are coordinating the patient's care because we know especially for our dialysis patients, they generally need to come to our clinics every 2 to 3 weeks for high quality care. In terms of communication, it needs to be, again, that listening ear. So the listening ear not only comes from the patient, but also comes from us as their care providers. And that ensures that the patient is at the center. We're listening to them, they're listening to us. We're speaking, we're engaging with them, we're using good, effective communication skills, and they're listening, they're understanding, and that trust is growing. And then finally, in the lighter green is respect. We need to make sure that as we engage in patient-centered care, especially at AHN, that we show respect to our patients. So that could be something as simple as speaking softly when we're at the bedside so other patients and potentially other caregivers don't overhear what we're speaking to the one patient, to just give confidentiality, to give that privacy and also that respect to the patient. We also need to respect patient choices. So understanding what the patient's choice is and their wishes, and then respecting that and making that part of the care plan is really important as well. So when we initially think about different aspects of effective communication, it's kind of like a puzzle. And there you can see it's not just one person doing the puzzle, it's actually a team. So if you can think of our AHN team, we know that there's a variety of people on our team. We engage with the patient and the family, sometimes even neighbors, potentially friends. When we think of effective communication, it's a variety of us interacting with the patient and whoever they call their family. So we need empathy when we want to be effective communicators. So empathy is the ability to understand and share the feelings of one another. This only can really be achieved as providers when we are humble with curiosity. So we need to begin to have a different attitude, or maybe you can expand on a current attitude that you have. If you're good at being empathetic, then you can improve that skill. But you can do this by saying, what can I learn from you? What can we learn from our patients? So here's an interesting image here with 5 examples of what you can do as a healthcare provider to become more empathetic or to show empathy to your patients. So number 1 is to be genuinely curious. To be curious, for example, something very simple about what a patient ate the day before, or what is their dream for their grandchildren. There's different ways for us to be curious, and sometimes it can be very simple, or sometimes it can be really getting to know our patients at the core of who they are as people. Being empathetic is also requires us to be good listeners. So it means that we can't be always speaking. We can interrupt. Being a good listener is not just listening to the words, but also understanding the tone of what the person is saying. The second one is validating patients' feelings. So if a patient is feeling overwhelmed or anxious or nervous, we need to validate their feelings. If they're feeling happy, we can also do that as well. The third one is imagining yourself in the same situation. So to become more empathetic, imagine we had chronic kidney failure or chronic kidney disease leading to kidney failure. Imagine us having to go to dialysis twice a week or even 3 times a week. As we think about that, and we think about how it would affect our life, how it would affect our families, we actually become more empathetic to our patients. Imagine what it's like to not be able to pay for transportation to get to your clinic or to get to your appointment. These are different ways for us to show empathy and begin to understand and share the feelings that our patients have. Number 4 is to be very present. So to be engaged with our patients when we're potentially hooking them up or unhooking them, when we're checking their weight, when we're doing their vital signs, being very aware of what's going on, being authentic, so being real. If we're also having an overwhelming day or we're feeling overwhelmed, we can say that. We don't need to tell them everything, but we can say we've had a hard week, or we're feeling overwhelmed at the moment. This shows that we are also human. We're also human beings like them. And to be supportive. Again, be yourself, share and feel with them. If they're having a difficult day or they recently had a loss in their community, being able to show grief with them, to be empathetic with them, shows that we can become more effective communicators. We do need to be aware of diversity. So we know that not all of our patients are exactly like us. Especially when we're sharing information, we need to keep in mind that the patient's life experience will determine how they understand and how they process the situation. So there's many different things which can impact our patients. There's many things that impact us as individuals and as human beings. So our education, our sexuality, our ability. Some of our patients are not as able as they were previously. And this does affect how we communicate with them. Some of our patients we know have difficulty hearing. Some of our patients are older. Some of our patients are young. So their age, their gender also can potentially affect how we communicate, their ethnicity, their culture, even language. We know that some of our patients, Swahili and English is not their main language, and we actually need to find good ways to communicate, potentially even through a translator. People's class or socioeconomic status, their race, again, their access to education could all impact them and their ability to communicate. And we don't need to judge our patients based on these things I've shared, but we need to be aware that it affects how they interact with us, how they understand their illness, and how they process being on dialysis and having kidney failure. We know that effective communication, it's very important that we acknowledge body language, because this is a type of communication in which physical barriers, other than just words, are used to convey information. So you've probably heard of this before, body language, things like facial expression, your posture, your gestures, eye movement, even touch or the use of space can all affect how we communicate with our patients and their families. So kind of some interesting statistics, 7% of the messages that are communicated are done verbally by words. And here we probably think as healthcare providers that most of what we communicate is the words that we say. But actually 93% is nonverbal. So that includes our tone. So 38% is our actual vocal tone, and then 55% is facial expressions, potentially our posture or those gestures we were talking about earlier. And it's quite interesting when we think of being more aware and engaged in a supportive care way to our patients. I'm quite curious about that. So much of the type of communication we do with our patients is actually related to our body and not what we say. We do know that when we begin to engage with our patients and we talk to them about communication and what is effective communication for them, the things that are most important for our patients. So what do our patients say? So here's some good examples from the research. Our patients say the things that are most important to them are honesty and empathy. Having information that is adequate, so that includes information that's clear and also understandable. Having a response to their concerns and also attention to their emotions. So our patients are looking for us to be attentive and aware and to respond to when they share any concerns. Our patients also want a discussion of what can be done with realistic goals and also to be part of decision making. So these are some perspectives of what patients are interested in, and there's the examples from research. We as providers need to be aware, and sometimes our awareness begins to affect how we interact with our patients. So we need to be very aware that our biases, our judgment, and our reactions can begin to impact how we interact with our patients. Our ability to perceive and understand the things that make us who we are, so we as healthcare providers, are caused by lots of different things. So they're caused by our individuality, our personality, our actions, but also our judgments and our biases and our reactions. People will forget potentially what you say. So here's an interesting quote, again, from the same person I quoted earlier. So she was saying that people will forget what you said. People will forget potentially even what you did. But people will never forget how you made them feel. And this again shows us that when we begin to interact and we have better effective communication skills, this really needs to be done from a non-judgmental perspective. Being aware that we can potentially judge a patient, for example, I'm thinking with our kidney failure patients, maybe on their lifestyle choices, on their culture. We need to be very careful when we do this. We know that if we're judging someone based on our own biases, we can't necessarily provide them holistic care. We need to be more understanding of what our beliefs are, what our biases are, so that we can, in turn, support our patients effectively and have holistic supportive care for them. When it comes to active listening skills, so you're probably curious, what are some of the skills that we need to learn so that we aren't judgmental of our patients? Well, some good examples here: don't interrupt. Be comfortable with silence, especially as we get more into talking about difficult information or breaking bad news. There might be moments where it's uncomfortable, where There needs to be silence because the patient is trying to understand what you've just said. We need to become more comfortable with those moments of silence. Some important listening skills are paying attention, withholding judgment, reflecting on what a patient has said, and also we are expecting our patients to reflect on what we've said. We do need to clarify. So if there's some misunderstanding or misinformation about what we've shared, we need to clarify that with the patient. It's really important that we summarize. So at the end of a discussion, we can summarize what we've talked about, what we've decided, and then definitely sharing. So if there's any more information that needs to be shared, we always do that in terms of listening. We want to pause because we know that sometimes when patients are talking or when they're wanting to share something important, they might pause. And we don't always have to fill that moment of silence with more talking. We can listen. So as healthcare providers, we need to try to focus on the 80-20 rule, where we as providers listen 80% of the time and we talk only 20%, so that the patient can talk 80% of the time and listen 20% of the time. This is really important as we begin to change the way that we interact and we engage with our patients. Having a relaxed posture, occasionally nodding, using verbal cues such as or yes, sitting at the side of the bed or bringing a chair over to the bedside is very important. We don't want to stand over our patients as we interact with them. We want to have eye contact. And of course, when culturally appropriate, we want to make sure that we engage and interact with our patients in an appropriate way. So when it comes to difficulties, what happens? Sometimes news or getting new information about a person's situation can be really scary and confusing. Patients don't always know what they're thinking, what they're feeling, and this is natural. It can be very painful for someone, a patient, to experience the judgment of healthcare providers when we say things like they're in denial. They're in denial about their situation. Patients need time. When we communicate effectively, we can give patients space and time to understand what's going on. Nothing can really prepare them for a diagnosis such as kidney failure. And it's really important that we as providers communicate in a sensitive and an empathetic way. So when we think about the term or the concept breaking bad news is often defined as any information that will change or alter drastically their view of the future. So if we think about someone potentially just initiating dialysis, chances are hearing about the fact that they have to be on dialysis potentially for the rest of their life, that could be somewhat bad news for them because it will change their view of the future. Patients and families will grieve when they hear this kind of information. So when our patients find out that they need to be on dialysis twice a week, they will begin the process of grieving, or they will experience grief. And we as a community may not always acknowledge that. So what is grief and why do we grieve? Why do our patients grieve? Why do we even as providers grieve? So if you start at the very left-hand side, we grieve because we love. So when we love someone or something, we're usually attached to it and we form attachments. So you have a patient potentially who has been working most of their life and they really enjoy and they really love working. They really love their job. They form an attachment to that. And when that attachment is cut, or when they're no longer, for example, able to work, they experience loss. And when we experience loss, we experience grief. Grief is normal and it is natural. It is how we process when something we have, we lose. And it can be something as simple as something that we can touch. So for example, land, maybe animals, if you were a farmer, your crops or your livelihood. It can also be intangible. So it might be something that we can't see. Maybe it's an idea or a dream or a goal. Grief isn't just related to death or when our patients die or when their loved ones die. Grief can be a friendship or potentially a job, as I had mentioned earlier. Many of us grieved when we experienced COVID. That was something that we actually, as a global society, grieved, situations of uncertainty. Many people lost their jobs, they lost their community, and they all experienced some sort of grief during that time. Grief is not a mental illness and doesn't need to be fixed. It's not described in that way. We know for our patients who experience kidney failure, there's a lot of anticipatory grief as well. So this refers to grief that occurs before a loss. So our patients and their families may experience anticipatory grief when they have a loss of control, or maybe when they have a loss of appetite, when they lose their health, or they have a change in their daily routine. It is experienced by people with life-threatening illnesses and their families. Again, an interesting comment about breaking bad news or sharing difficult news. If we do it badly, the patients or family members will never forgive us. If we do it well, they may never forget us. So as we interact and as we engage in empathetic communication with our patients, as we share difficult news in a compassionate way, our patients may never forget how we do that with them. They won't blame us for the situation because we've done it in a compassionate way. Now we're going to move on to some tools. So you may or may not be the main person that shares difficult news. You might be in a family meeting where difficult news was shared. Some of these tools you'll be able to use going forward with your work at AHN. So the first one is called SPIKES. It's an acronym. The second one is called REMAP. And the third one is called the Serious Illness Conversation Guide. And all of these guides or tools can be used. We can print them out or you can save them as a photo on your phone. It doesn't need to be memorized. They are a little bit lengthy, but these are really helpful tools that we've been able to use here in Kenya, but also in other situations as well. So the first one is, this was developed in 2000, and it's 6 steps, a protocol for us to help engage with patients and families as we share difficult news with them. So the S stands for setting. So we want to choose an area that's private, comfortable, and non-threatening to give difficult news. So if we think about our AHN clinics, this could be potentially one of the meeting rooms or the office room, maybe even the isolation room if there's no patients there, a room where we could potentially close the door and share a private conversation with patients and their families. The next step is perception. So we need to begin to understand and uncover what do patients and families think is currently happening. This will help us as we share more information. If a patient already knows that they've been on dialysis for a long time, they've had some serious symptoms, and we wanted to talk to them a little bit more about managing at home and if they need some extra supports at home. If that's actually what they understand, then the new information that we give them may not be any different. If you're going into a situation where a patient is potentially transferring from inpatient to outpatient, and they may not really fully understand that they have chronic kidney disease and need to be on dialysis long term, we can usually understand that by asking them, what do they currently understand about their health situation? And we get a lot of information from patients, and that may impact what we share as we go forward. We then invite and ask patients what they would like to know. So we ask them, what are you interested in knowing about your health? Again, this helps us guide the conversation and invites them into the conversation by sharing what they're curious and what they're interested in knowing. In the knowledge or the K, this is where we begin to explain in more detail about their disease and their treatment care. and the options that they have in very plain and simple language. We need to respect and respond to patients' emotions. So we need to respect their feelings. They might be angry. They might be frustrated. They might be in shock. We need to make sure and the last step is to summarize. So here we would recap what has been discussed, and then we make a decision about what is next. And we share that with the patient and the family. The next example here is called remap. So here are some good examples of what we can do as we talk to our patients about their goals of care. So here we've shared some difficult information with the patient. So we might be discussing some blood work or a recent scan that the patient has. And we could say something such as, given this news, it seems like it's a good time to talk about what to do now. We're in a different place. So this might be for a patient who's been on dialysis for a long time. Potentially it's for a patient who's been an inpatient and then shifts to our outpatient. We reframe why the status quo or the current treatment plan is not working. We then expect emotion, and again, we respond with empathy. It's hard to deal with all this, are some things you could say. I can see you're really concerned about. Tell me more. What are you worried about? Is it okay for us to talk about what this means? These are all good examples about how we can help our patients explain their emotions. We then want to help patients share with us what's important. So given this situation, what's most important for you? When you think about the future, are there things that you want to do? As you look toward the future, what concerns you? And then we as a team need to align with the patient's values. So you could say, as I listen to you, it sounds like the most important things are, and then you could give some examples of what they've just recently shared. And then we plan to match their values. So we as the clinical team can then come up with a plan of what aligns with the patient's values. So here's what I can do now that will help you with those important things. What do you think about that? These are just some good examples of what you can do and how you can interact and what you can say as you engage with patients. This is the third example that we're going to share for today. And this one is called the Serious Illness Conversation Guide. And I can share these examples with you. So in this one, the setup is, I would like to talk together about what's happening with your health and what matters to you. Would that be okay? We then assess. So we then begin to understand, what does the patient know? To make sure I share information that's helpful to you, can you tell me your understanding of what's happening right now with your health? And then we say, how much information about what might lie ahead with your health would be helpful for us to discuss today? And in this moment, then you can begin to share based on what they've responded. Can I share my understanding of what might be ahead for your health? We can say things that we are uncertain about. So for example, you could say, it can be difficult to predict what will happen. I hope you will feel as well as possible for a long time, which is true. We hope that for all of our patients. We will work hard towards our goal. It's also possible that you could get sick quickly. And I think it's important that we prepare for that. You could also say, if you knew a patient was closer to the end of their life or depending on their certain prognosis, you could say, I wish this was not the case, which again is true for all of our patients. We wish that they weren't in this current situation. And then you could say, I'm worried that time might be as short as potentially weeks to months, you could say. Or you could also say, it's difficult to predict what will happen. I hope that you will feel as well as possible for a long time, and we'll work towards this goal. So that's very similar. It's possible that it may get harder to do things because of your illness. And I think it's important that we prepare for that. And it is really important that, again, we allow for moments of silence and we validate and explore their emotions. You can explore emotions by saying things such as, if your health gets worse, what are important goals? What are your biggest worries? What gives you strength as you think about the future? What activities bring you joy and meaning in your life? If your illness was to get worse, how much would you be willing to go through for the possibility of more time? How much do the people closest to you know about your priorities or your wishes? Have you talked about this at all? About what are your hopes about your health? And then you would close by saying, based on what they've shared, I hear that you are saying that such and such is really important to you and that you're hoping for, and then you can give an example. Keeping that in mind, we know, and what we know about your illness or your kidney failure, I recommend that we, and then you give your recommendations. This will help us make sure that your care reflects what's important to you. How does this plan seem to you? And then you can end by saying, I'll do everything I can to support you through this and make sure that you get the best care possible. And this is a really empathetic way to engage with our patients and interact even when we're sharing really difficult news. So we're now going to shift into a time of discussion. I see that we only have maybe 15 minutes or so left. I'm wondering if there's any questions related to this type of communication or engaging with patients. Okay, so Lydia has a question. How do you handle a patient's breakdown to ensure continuity of the conversation? So I definitely hear you, Lydia. Sometimes when we're having these conversations with patients, they can become very emotional. So they can potentially cry, they can get very silent, they can get angry at us. I think the best thing to do in these kinds of situations is to acknowledge the emotion that they're showing. And it could mean that we may need to stop our conversation. So it may be too overwhelming for a patient to have a discussion on that day or in that moment. I think we need to be very sensitive to that. So we may have wanted to have a very lengthy conversation and identify exactly what the patient's wishes were on that day, but that day may not have been the best day for our patient. So we need to be aware of that and sensitive to that. And then when that happens, we don't want to just leave. We don't want to leave a patient crying or feeling very upset. So sitting with them, potentially holding their hand, getting them tissues. If they have a caregiver, we could go get a caregiver and allow the caregiver to sit with them. We can acknowledge their emotion and say, yeah, this is really, really difficult. This is really sad. We want to try, I know in Kenyan culture, because I've lived in Kenya for more years than I've lived in Tanzania or Rwanda, but I know one of our common things here is we say, don't cry. We say, don't worry. I think as a community and as providers, and especially as champions of supportive care, we should try not to say that. If we don't know what to say, we could just be quiet. I think by us saying don't cry doesn't allow a patient to feel sad sometimes. And it's not necessarily going to be easy for us because we can also feel embarrassed, right? That the things that we're talking about with the patient has made them cry. But I do believe the reality is the patients are overwhelmed by emotion. It's not that we've caused the situation to happen. We've allowed for a moment when they've really thought about their life. And it is really sad. It is really sad that our patients are sick and they have to be on dialysis. So allowing a patient and also acknowledging the emotion can really be effective. And then definitely if they're seeming to be very overwhelmed, again, just acknowledging that, saying today, I'm really grateful that we've been able to talk, that we've had a discussion. I know, and I can tell, and it seems like you're feeling very upset. I can stay here with you. We can keep talking today, or I can come back next time you're in the clinic and we can continue to talk about how you're doing, how you're feeling. It does oftentimes become easier as we engage more with our patients to be comfortable with emotions that in general our cultures are not comfortable with. And this takes time, it takes practice. Yeah, Sifa, I see your question here. So can we involve patients too? Yes, we definitely want to make sure that when we engage with our patients in that patient-centered care model or the family-centered care model, we include family members when we talk to patients, because we do know that there is an emotional process that patients go through, and they may experience denial, right? Their life is very different than maybe they expected it to be. And that overall understanding of their illness, maybe they are denying aspects of it, that this is going to be for the rest of their life. It is important for us to engage with family members to make sure that the family, the patient, and the healthcare team is in alignment. The difficult thing is it doesn't happen with just one conversation, which I think sometimes in healthcare, we want things to be easy, check it off the list that we've had a discussion with them, and then it's over. That's not always the way it works. There may be someone in a patient's family that knows the patient better than we do, most likely because we may have just met them, or we know aspects of their life, and a family knows a different aspect of their life. I think including family members, not embarrassing a patient, not making them feel juvenile, not shaming them for being in denial or experiencing emotions of denial. But I think including the family can be helpful, not to create conflict between the family and the patient, but including them, because then maybe they can also follow up with the patient when they're at home. I don't necessarily know for denial if patients that are really struggling and not acknowledging aspects of their health, I don't think that they will pass through it quickly. So if we have a patient that's really struggling emotionally, psychologically with their illness, with the fact that they're on dialysis, with the fact that, based on really good conversations we've had, and then they continue to act as if this is not a major life change for them, I think bringing in other teammates, family members for sure, potentially referring them for counseling can be helpful. If you have any more questions, we can go through that. I did want to share the case quickly. So if you do have an extra 5 minutes or so, I'd be really curious to just have a discussion about this case. But I know having skills in terms of effective communication is really important. So, sorry. So I want to introduce to you the case. So the case for today is a 71-year-old woman who's receiving in-center hemodialysis. So she's an average patient that we would see at AHN. She has unfortunately had frequent hospitalizations due to her right arm fistula. So she's had long-term occlusions of the central vessels on the left and recurrent central venous stenosis on the right, which is required frequent angioplasties. So she's ultimately advised to go with a temporary catheter, and an evaluation is made for potentially a new vascular access. The hemodialysis unit staff noticed that her affect has begun to change. She's disengaged, she's tense, she's teary, she's also irritable. She initially was reluctant to talk about her mood, but after a while, she feels and she shares that she's feeling depressed and that she's quote unquote trapped in a nightmare. So it's very serious for this patient, using words such as trapped in a nightmare. The patient has no husband. She's 3 children and several grandchildren. She's the matriarch of the family, and her children rely on her for finances as well as emotionally. The patient and her children are aware that she's ill, but still not aware of her prognosis with the most recent hospitalization and her infections. Her children have a different view on how to discuss the potential decline in her health status. 2 of her children want to tell her mother. The other child doesn't want to share any more details with her mother as they feel it will affect her too much. This is advanced kidney failure. There's no cure for her illness, and the risk for infection with her temporary catheter is very evident and clear, including potential frequent hospitalizations. The patient needs to be and must be supported in the change in her situation and needs to be told in a compassionate way. So in the last few minutes of the session for today, we're going to talk about how can we go about doing this. So what are some important, using that example that I shared earlier, the spikes, so SPIKES, those are the different examples. What are some of the most important considerations when we think about the setup, so the initial environment? So we can put it in the chat. I know we don't have a ton of time left. But what are some things that are important when we think of the setup, when we're going to give some information about the fact that there is a risk getting a temporary catheter? She obviously already has been hospitalized many times. Sounds like she's very emotional about it, even potentially depressed. It's important with our setup. So you can put it in the chat, think about it. I'll give you some of my examples. As I know, we're running a bit short on time today. But generally, what we want to do is we want to make sure that the patient has access to a private area. So give privacy. We want to make sure that we've included any important family members. So for this case, we probably should include the patient's children, and we would want to include both the children that are wanting to share information as well as the one that's nervous about it, potentially even including a counselor. We then want to understand, what does the patient and the family know about currently what's happening? What could you say if we want to understand what the perception is of her current status? So I've given you a few examples there. What have the doctors told you? You could be just as explicit as, what have you already heard about your illness? What have you understood about what's going on with your health? And in a few short sentences, our patients should be able to explain what's going on. In some cultures, it might be the family members who will respond to that question, but from their understanding what's actually going on with the patient. And this will then guide us as we share more information about current situation. Yeah, definitely, Gladys, we need to make sure that if we're sharing some new information, that we give her private space. So maybe one of the private rooms at the clinic, and then definitely including the family. You're right on. So we want to make sure we include the family in that meeting when we're giving some more information. So the next one is I. So we want to invite them and ask them. This is when, for example, if a patient is very emotional about what's happening and we ask them, can I tell you some more information about what's happening in your health? This is where they could potentially say, no, today's not a great day. I'm feeling really overwhelmed. I don't actually want to know more information right now. So if at that point the patient clearly has said that they don't want to have more information, then we need to stop. We can't continue to share information with them if they've told us that they can't. Most often they'll say, yes, I'd like to know more about what's going on. So then when it comes to knowledge, we want to share more information with the patient. What could we say? I've actually, I put it on here. I better make sure next time I don't advance the slide as far. But in terms of knowledge, we could say, unfortunately, I have some bad news. And then we could pause and we could say the condition of your kidneys and your fistula, so their access, has resulted in you having a temporary catheter for future dialysis treatments. The risks of the temporary catheter include infections. Again, that's very clear. Although we cannot cure your kidney failure, we want to continue to support you, which is true, and treat you at the clinic. Again, we will continue to focus on how to support you, your emotional situation, and help relieve or alleviate any distressing symptoms to ensure you have a good quality of life. And again, that is true. That is what we want to do. So our patients may have a variety of emotions. So we've just shared that we can't use their fistula anymore. It's blocked. They'll have to have a temporary one. The risk of infection is high. They may be feeling certain emotions, and the E stands for emotion. So we can name the emotion. We can say, I can see you're feeling really angry, or you're feeling really sad. Is that correct? Tell me more about how you're feeling. We do want to understand their emotions. So we can say it's normal for people to feel that way in your situation. We don't want to shame her or make her feel embarrassed. We give respect. We say you've shown courage. and we're here to support you. You are not alone. And then we do a summary. So we review what we've shared. We've shared that the patient now needs to have a temporary catheter. There's a risk of infection. We can't use their fistula anymore. We asked, do you have any other questions? And we support them in coming up with a plan. So just a few other questions, and then we'll finish for today. I'll put these in the chat so we can, and I'll stop sharing my screen. But the questions are, how could you support sharing this news with her children? What would you say to the child who doesn't want to share the diagnosis with the mother? Do you think as a healthcare provider, you have a responsibility to tell the mother? How can we be honest and clear? And then the last one is just knowing about a diagnosis or knowing about a situation in someone's health. Families knowing can help them plan and prepare for the future. But yeah, we'll see you guys